So the purpose of our research is to identify a non-invasive imaging biomarker for outcomes in mild traumatic brain injury. We know that although the majority of patients will recover from MTBI, there will be a subset who experience long-term morbidity. And so the purpose of this research is to prospectively identify those at risk. And this research is different from prior studies in that multiple prior studies have demonstrated a significant association between low FA and outcomes, but few have identified a robust predictive biomarker. And so the purpose of this study is to employ an individualized approach to abnormality detection and specifically examine radial diffusivity, which may be a marker for more severe irreversible head injury.
I think an important thing to recognize is that in thinking about why this matters, it's not just about diagnosis. If we just want the diagnosis, we could wait until people eventually have persistent problems. But there's likely to be a window of opportunity early on following a concussion when we have a chance to intervene. And until we know who it is that's going to have the long-term problems, we really can't intervene and we can't design appropriate treatment trials. So this is really an essential preliminary step to being able to do meaningful treatment trials in concussion, which is a disorder for which there is no treatment right now.
Mild traumatic brain injury is a heterogeneous injury, and so in all likelihood no two individuals will have identical distribution of abnormality. And so whereas the majority of prior studies performing longitudinal studies have performed group-level comparisons between patients and controls in order to detect abnormalities. This is actually a single-subject approach, an individualized approach in which we compare each individual subject with a group of controls to identify subject-specific abnormality. And the idea is that this will be more sensitive to pathology that may be important to outcomes.
And so if we think about how the group analysis operates, if we're comparing a group of people who have an injury to a group of normal individuals, we're really only going to pick up the areas where they're similarly abnormal. But the reality, as Sarah said, is that these people are all abnormal in a different way. So looking at them as a monolithic group is essentially throwing away a lot of really important information, which her approach is able to capture.
So the findings of this research were that abnormally high radial diffusivity in the temporal lobes was significantly associated with worse outcomes in executive function in 1 year. This was true of both the left and the right temporal lobes. So the clinical implications of this research are both relevant to prognostication and also patient management. The way things stand now, in general, these patients are seen in the emergency room setting only and are basically evaluated and then discharged, told that they'll in all likelihood recover, and then subsequently completely lost or almost completely lost to follow-up. But if we can prospectively identify those at risk for worse outcomes, we can then first of all sort of manage patient expectations in terms of the course of recovery, and then also better direct them towards follow-up and therapy.
And in terms of where this leads for the future of therapy, because today, really the only treatment for these people is to tell them to rest until they hopefully get better, and most of them fortunately get better. But we have to understand that traumatic brain injury is not an injury that happens in its totality at a moment in time, that it's an injury that actually evolves over a period of time, and during that time there is ongoing bad stuff happening in the brain, whether it's inflammation or degeneration of neurons. That's potentially a window of opportunity where we could apply treatments to the people who need them and can benefit from them so that they don't end up with those outcomes down the road. Now that's a future goal, but this kind of research that Sarah is presenting is really what's needed first to be able to do those kinds of treatment trials. So your approach is able to tell us who are the people that need treatment, and those are the people in whom we should study treatment. If we just study everyone with a concussion, most of them get better anyway. So we're never going to be able to tell whether a drug or some other treatment we give really has some kind of an effect or not.